Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Management of abnormal uterine bleeding. If there is mild to moderate bleeding, the first line management is non-hormonal management. Non-hormonal management can be with the help of tranexamic acid or mefenamic acid. Tranexamic acid or mefenamic acid are used for dysmenorrhea. Oral contraceptive pills are used for irregular cycles. The best management in mild to moderate bleeding is oral contraceptive pills or progesterone pills or intrauterine contraceptive device with Mirena. This is if there is mild to moderate bleeding. Management of severe um, abnormal uterine bleeding. Severe abnormal uterine bleeding can be divided into two types, whether vitals are unstable or vitals are stable. If vitals are unstable, then you should do dilatation and curettage should be done. Except the dilatation and curettage is not done in virgin females. So dilatation and curettage can be done. Second, you should give IV estrogen. Intravenous estrogen is given. In India, we give high dose oral estrogen can also be given, and then shift the patient to oral contraceptive pills or progesterones. This is if the vitals are unstable. Second condition, if there is severe uh, abnormal uterine bleeding and vitals are stable. If vitals are stable, then you should see the age of the patient. If vitals are stable and the age of the patient is more than or equal to 45 years, then we do endometrial biopsy. If the vitals are stable and the age of the person is less than 45 years, in such case you should check for ultrasound report. If you see that the ultrasound in the ultrasound report, if the patient has thin endometrium, if there is thin endometrium, then you should give high dose estrogen. Oral estrogen is given, that is oral contraceptive pills or progesterone is given. If the patient So if there is thin endometrium, then we will give high dose estrogen followed by oral contraceptive pills or progesterone are given. Then if the patient has thick endometrium or normal endometrium, in such cases we should give oral contraceptive pills or progesterone is given. Because thin endometrium, the progesterone or oral contraceptive pills will not act on thin endometrium. They will only act on estrogen primed endometrium, that is in thick endometrium. So first in thin endometrium we should give high dose estrogen so that estrogen can prime the endometrium, and then we give OCPs. Whereas in thick endometrium we give OCPs and progesterone directly.
thank you and thank you for watching.